This week, fears that Ebola may have reached our shores were raised when a young woman from West Africa was admitted to Royal Brisbane Hospital for testing. She's since been given the all clear, and while the community has breathed a sigh of relief, it was a reminder that for some of us the impact of Ebola is heartbreakingly real. The virus has killed almost 5,000 people since the outbreak began in a remote part of Guinea in March. And tens of thousands of kilometres away, distance has done little to ease the pain. As local health authorities battle to keep the deadly virus out of Australia, grief-stricken Queensland families are coming to terms with another blow: the federal government's decision to halt immigration from Ebola-affected countries. Courtney Wilson has been talking to those who are proof that suffering knows no borders.
It's mid-morning, but Francis Davis is just beginning his day at home in Brisbane. He's been awake most of the night, fielding calls from family in Africa.
You go to sleep, and once that phone rings, you get that playing in your head. Okay, is somebody dead or is somebody sick? Hello?
Francis came to Australia as a refugee in 2004. Many of his family still live in Liberia, where Ebola has killed 2,500 people.
Is anyone sick? Is anyone sick? Is everybody okay? From my mom's side, there have been I think number of 8 last one I checked, and it's been very difficult. And you never know when that phone call is going to be made and what you're going to be told.
As president of the Liberian Association of Queensland, Francis Davis is never sure what each day may bring. This week, his community was thrust into the spotlight.
A woman is tonight in isolation in a Brisbane hospital being tested for Ebola.
One of their own, an 18-year-old woman who arrived in Brisbane a fortnight ago, presented with a mild fever last Sunday. The teenager was immediately tested for Ebola at the Royal Brisbane Hospital.
She didn't have any known contact with anyone that was sick with Ebola virus disease, but she did come from an area that had a reasonably large number of cases.
She didn't have the disease and has now returned to home quarantine.
We are the first, and I understand the only state, that has moved to isolate people coming in from places where Ebola is known to exist for a period of 21 days.
19 people from 4 separate families are in voluntary quarantine in Brisbane homes.
We've met with them and we said, listen, it's for the benefit of all of us, even including the wider Australian community.
We've given them iPads so that they can Skype people and still remain in contact with people, so they can't have any visitors, but they can talk to people over the phone, Skype and so forth.
The government systems and processes, Madam Speaker, are working to protect Australians, and that is our focus in addressing this issue.
On Monday, the federal government moved to suspend all visas from Ebola-affected countries.
These measures have been put in place in partnership with the Minister for Health, who leads the government's response.
The decision has left families hoping for reunification stranded on opposite sides of the world.
My sister, his son.
Helen Fafana is grieving the loss of her nephew, Sekou. He was young and healthy and a provider.
He was helping to support this family. Yes.
Ms Fafana was on the phone to relatives in Liberia when Sekou lay suffering inside the family home.
They heard him yelling. His stomach is hurting. He needed water to drink. No one was able to go there.
Sekou died 2 days later in isolation and in agony.
He was in the room crying for help. No one was there to help him. They told me that.
She had hoped to bring her nephew's children to safety in Australia.
Because I have the means to take care of his kids. Because I've been there for him. And when he's not alive, please, his kids should be my children as well.
In a suburb 10 minutes away, Francis Cooper is also worried. Her grandchildren are still in Liberia, and her plans to sponsor their immigration to Australia are now in jeopardy.
I've been trying almost 2 years now to get them over. I've been trying. I want to bring my children over. They are very, very little, very, very small.
The latest Ebola outbreak has killed almost 5,000 people in Guinea, Liberia and Sierra Leone. Australia has been asked to provide medical teams. So far, it's declined because of the distances involved should a health worker become infected. The Immigration Minister says the government's priorities are Australian lives and border safety, and that current measures will be regularly reviewed. Queensland's top doctor wouldn't be drawn on whether she thinks the border shutdown is necessary.
It's a decision they've made. We'll work with whatever decision is made at a Commonwealth level.
This week, Dr Young has been doing her best to allay local fears about Ebola and its potential impacts.
The chances of Queensland having a case of Ebola virus disease present is very low, but it is there, which is why we've done all of the work to date.
Few people understand the impact of Ebola better than Queensland's West African community.
It's not easy. The community is actually grieving, and it's something that we know we have to be strong, but it's difficult to cope with.
And there's the added burden of being targeted because of fear.
The Ebola Task Force Committee we've set up is to talk to our members to be strong, to not take any offense to what somebody might say to them, have a good approach about it.
It is not easy for we the Liberians, so I'm appealing on behalf of the Liberians all over the world, not only in Queensland, that the government should please help us with our family back home, please.
Helen Fafana says she understands why Australia's doors are closed to her family at the moment, but hopes that one day soon there'll be an end to all the suffering.
I hope after the Ebola, they can please let her to come in, because I need my nieces to come to me. I'm hoping to hear good news one day to say it's over, the Ebola is over.